Hello, my friends, family, esteemed colleagues. Request came for me to explain a little bit better what causes tendinitis or tendinitis and how to go about it, how to even protect ourselves from it, or if we already suffer from tendinitis, how to overcome this. Well, again, let's first briefly have a look at our exploits of soyence. Okay, so here we have our trusted Mayo Clinic and tendinitis, the scientific way, where it's inflammation of the fibrous cord that attaches muscles to bone, which are tendons. Okay, now, what do they say about tendinitis? There are types of tendinitis. Again, depends on location, depends on manifestation, but basically, we want to know culprit, how to prevent it. Well, symptoms: pain, tenderness, mild swelling. Okay, causes. Tendinitis can be caused by sudden injury, okay, by repeating the same movement over time is a much more likely cause, which means repetitive use of the same muscle. Well, this is a lot of nonsense if you ask me, and we'll talk about it. And there is absolutely nothing else that is being said. Basically, if you repeat same movement using the same muscle very often, this is going to cause a stress on the tendon, and tendon is going to inflame, according to soyence. A risk factor: people, again, that do jobs when they use one particular muscle more than others. Age, older people, which are also less flexible. Okay, of course, older people. Well, we know why, but we talk about it. Work that is going to cause it. Again, same thing, repeated motions, awkward positions. Activity, okay, that's nothing new here. Medications, well, some medications can make this problem appear faster. Here they mention that the particular medication in question will be antibiotic of fluoroquinones or fluoroquinolines. Corticosteroids, well, we'll talk about it. Aromatase inhibitors. Why? Aromatic phenols. I mentioned their toxicity before. Prevention. Ease up. Improve the way you move. Well, stay in a bed all the time, and you are not going to have to suffer from this. This is basically the recommendation. Okay. Well, is there anything? Diagnosis and further treatment. Well, diagnosis is very simple. Tendon will hurt when you engage the muscle, and it may swell and even be painful on touch. Treatment, relieve pain, well, reduce inflammation, anti-inflammatory. Well, again, pain relievers, steroids, injecting body plasma, concentrated body plasma into the affected area, a type of a kind of a homeopathic approach, which brings a relief, but it does not really get rid of the problem. Of course, surgery as a treatment, bad choice. Okay, so now when we know the expert view on this thing, let's just discuss it. Okay, now when we know the experts' view on what causes tendinitis or tendinitis, let's now use the Google. Let's just elaborate a little bit. What is tendon? Tendon is on the opposite ends of a muscle, and they actually serve as the anchors to anchor the muscle into the bone that keep the skeleton in its position and allows movement of the joints. Now, we know that muscle is red because it's full of blood. Muscle tissue is very well vascularized. A lot of blood is going there. Why? Blood is the electric charge that muscle needs to contract, and also brings plenty of nutrients and eliminates a lot of leftover, whatever cells eliminate, metabolic products. All this has to be eliminated. So good flow of blood has to be available, and of course ample amount of oxygen has to get there. But the ending pieces, they are simply anchors. They just hold the muscle in a position, and they are white. Now, why are they white? Because they don't have muscle cells in them. It is basically just connective tissue constructed of more or less, to simplify, two different tissues. One of them is collagen fiber, which is rigid in between. It's a dense, and it is what causes the structural part of a tendon. It doesn't stretch much, it's very low stretch, and it is very strong. And the collagen fibers are then wrapped into a tunica, which basically covers them. Also connective tissue, also collagen, but much more elastic, much more flexible, and well hydrated. And through it actually goes lymph. And since the tendon does not have really much to do, it is there to be sturdy and to be in place. It does not need a lot of nourishment, but it has to be well hydrated, and it is enough to supply it with lymph. Now, this brings additional benefit because tendon has to be strong, and toxin is going to affect it badly, weaken it, and to be exposed to least amount of toxicity, well, this is one of the reasons why it is supplied with lymphatic flow, because we know lymph is much cleaner than the blood, and bigger particles cannot go through it. This is why even red blood cells cannot go through it, because the capillary system is much thinner, much smaller volume, and it serves like a filter Now, again, this could be quite confusing when I say lymph is cleaner than the blood, and on the other side, we always hear, oh, lymph is sewer system of the body. Well, because a lymph is actually blood plasma without some blood elements like red blood cells. And when you have arterial blood, which comes from the heart to supply the organs and the cells with oxygen and fats and vitamins and enzymes, hormones. So this type of a lymph, when it goes into smaller and smaller arteries and capillaries, which basically kind of filters itself away from arterial blood, this is a clean lymph. It's cleaner than the blood. It's the cleanest liquid that you have in a body. But then, as it enters the area where the cells are and penetrates into the cell and then comes out of the cell and flows, well, whatever is passed on the return way back to circulation, well, this is then way more toxic. Okay, so lymph could be both. Could be the cleanest liquid in the body and could be also the dirtiest one. Well, what happens with lymph or plasma, or blood plasma or lymph of the body, that if blood cannot cleanse correctly, the toxic level of blood increases. And toxins are just simply either excessive elements in the blood that should be eliminated from the bloodstream because they start serving as a suppressor of electric flow, but also they are out of tune frequencies. Even emotions are considered there as toxins. Now, the more toxic is the blood, inevitably more toxic is going to be the lymph that comes out of the blood and goes in, the smaller pieces of wrong frequencies that can penetrate the small capillary system. Well, they are going to be there and they will be polluting the tissue. And what is happening? The cells will not hydrate well. And here it is saying, what is happening with the muscle? I explained it many times, that on a cellular level, when you dehydrated muscle cell, well, then the organ, the muscle that is formed from these cells, dehydrated cells, well, the electromagnetic potential is down. So the muscle loses tension. And this is what loosens the joint. Joint starts playing in the seat. It's not firmly tight in there, but it's loose and it has much more movement, not only in the right way, but also can grind the surface in different ways. And dehydrated muscle, when cells are dehydrated, these cells become also more brittle because even the membrane structurally becomes fragile. So doctors know when they are stitching hernia, they know the muscle is very brittle, and they know if they stitch it, most likely it is going to break right there on that stitched area. And if not there, right next to the stitch area. It's going to continue breaking. So this is why in the case of hernia, mesh is being put in there because it's anticipated that this breaking through the muscle is going to continue because muscle became brittle. Well, not only muscles do become brittle, so will all tissues that are composed of dehydrated cells. And ultimately, if you supply enough toxic lymph into a tendon on cellular level, it is going to start getting toxic, dehydrated. It becomes toxic because it becomes dehydrated. The cells cannot wash off the toxins because they are dehydrated. And more dehydrated collagen fibers are, the more white they become. Normally they should be more on yellowish side, but they start getting almost like cirrhotic. They start getting whiter. And they lose flexibility, but they become brittle. And now if you have dehydrated tendon and you put strain on it, you work it out, well, the inner collagen fiber doesn't stretch much. The tunica around it can stretch because it's better hydrated. So even during dehydration, it's still better hydrated and actually becomes even more stretchable, more flexible. But that outer cover has sensory nerves. Normally, the fiber of tendon do not stretch. Very lightly, very small stretch. And this doesn't affect sensory nerve. But what can happen because of the dehydration on a cellular level, the fiber are weakened, they become brittle, and they may start cracking. And if some of those collagen fibers break, then the remaining ones will allow a little bit more stretch, and this is going to make pull on the sensory nerve of the fascia around them. The tunica, fascia, same thing. And it will start causing discomfort and pain. Also, if these little breakings occur, now body tries to resolve the situation, tries to heal it. And number one, it has to prevent you from using the muscle, not to create more damage. So lymph liquid is going to start accumulating there. It is not a typical scenario of muscle or other tissue inflammation where you have constriction of blood vessels, which create a higher level of blood accumulation, pressurizing before it can come out through vein, causing the inflammation, and then consecutively the pain because of expansion. Here it's almost more as a water retention than it's actual inflammation, but similar consequences. The buildup of a liquid creates more pressure in the area, and since the tunica there is fascia, whatever you want to call it, is a little bit more flexible, stretchable, it is going to kind of expand a little bit, and because of the buildup of the retained lymph there, and cause pull on a sensory nerve, and it hurts. Of course, this we can call like partial break of tendon. In this case, you have to stay mobile because body will try to mobilize you. So not only that you are going to be accumulating liquid there, but you can also accumulate the synovial liquid because another name of that tunica is synovial shield or synovial layer, may accumulate also in the joint to mobilize the joint, not to move it. So it may kind of mimic arthritis, although it's not arthritis. You actually have a problem with tendon, but both things occur just to mobilize you so you do not move the knee or elbow or shoulder, whatever joint is being affected. Of course, then smart scientists know that they can pull this liquid out, the synovial liquid out, and enable the movement, and they call it curing. Well, now you are actually working against the body, because now you are allowing movement of the joint that the body intentionally locked in a position, so it does not move, so it gives time for the tendon to heal. And since you start moving it, and now as you are moving and the tendon is partially out of order, so it starts making stronger movement, this hurts, and more liquid starts, more lymph starts getting impacted in there, more water retention within the tendon, and you may feel it like a little bubble occurring on there, very painful, and ultimately you won't be able to move. So you'll be given painkiller or steroid. Now, why steroid? Because steroid is a natural painkiller. Body produces steroid that basically the purpose of it, corticosteroid released into the blood, is to enable body to go into its highest potential because the life is in danger. So you could have, let's say, a fissura, a half-broken bone that also is painful. You can have even tendinitis. You can have a partially injured tendon that is also painful. And your body is trying to heal it, so you will have also then a swollen joint, most likely. And all of a sudden, there comes a freaking bear. Well, what is now more important? Save the joint and heal it, or hell with the joint, let's get out of here? Well, this is basically the programming of the body, is the second one. All bets are off when life is in danger. So when corticosteroid is being injected into the blood, there is immediate loss of pain, inflammation immediately goes down. Everything opens up, because forget about the tendon, forget about the joint, let's save the life, let's get out of there. If you break the joint during your attempt, well, you still have more chance limping and running, limping because the leg or arm doesn't work properly, so you have little difficulty with movement, but it doesn't hurt. So you can use the rest of the body and you can get the hell out of there, or even take some stick and defend yourself. If you would stay in a healing position, every movement would be excruciating, painful. So you won't be able to do that. So the purpose of corticosteroid, adrenaline, is there to basically disable all these healing stuff and all these warning signals, so you can save your life. And doctors are using this basically as a part of the miracle cure system. Well, you are not curing anything, you are basically enabling the body to injure itself more, because it has no feedback to take it easy. Steroids first were used on horses. So the horse that has little limp can finish the race or go into race and not be bothered by the limp. Steroids, and horse is ready to go. And let's heal the horse later. Well, in people, now they're using steroids as a common aspirin. Every little problem, corticosteroid. Because you know it's going to work, but it is putting body in worse jeopardy of injuring itself much worse and creating incurable situation later. So, in worse situation, when cellular dehydration becomes so problematic in the tendon, it can cause the attachment or detachment of the tendon from the bone. And the only solution there is to reconnect it, which is a pretty tough job to do. Surgery has to be done with our type of a medicine. Of course, when we go into quantum medicine, no surgery is necessary. Everything can be done in a quantum field through vibration, because ultimately everything is vibration. But this time is coming now that new equipment is going to be healing us using the frequency, so no surgery will be necessary. But still, today, the only solution of detached tendon is to surgically attach it. Put it back in place, put a couple of screws in there, and wait for it to grab in and start digging, creating the fiber, the connective fibers, the collagen going into the bone, from the tendon into the bone, and anchoring itself there. It's a process. But then again, how come that, for example, football players, they usually have a problem with the tendons around the heel and sometimes around the knee? Why? Because these are the areas the foot is dancing, so these tendons are working like crazy, on a foot, of course, not on a hand. And then on the knee, I'm showing shoulder because I cannot show you my knees. So also the muscles that are flexing your leg, kicking, running, well, mostly are using your quadriceps and biceps to kick and run. So the tendons that are connecting the two bones to make possible the movement, they have a lot of load on them. And since, as a football player, you are running a lot and kicking a lot, well, you are using particular muscles more than other muscles. And if you're using the muscles, then more tension is being done on those tendons which hold these muscles. Which means more blood, as I always explain, muscle that you use more, organ that you use more, will be in the need of more blood, so has a higher circulation rate. And if the blood is toxic, it will bring more toxins. Well, same happens with muscles and tendons. And this is why the experts are saying, well, if you do same movement a lot, then the muscle, the tendons of the muscle you are using will most likely be the one that will be affected. Well, this is true, but they forget to mention that this happens if the blood is toxic. If the blood is not toxic, no amount of movements are going to create any problem. This is why majority people do not have problem with tendons. But some people do. And as a football players, also, not every football player is going to have problem with tendons. The more you take care of yourself, the cleaner you eat, the cleaner you drink, no coffee, no tea, eat more carnivore diet, less plants or no plants, and drink more water. And you are not going to have problem with tendinitis, no matter what you do, no matter how much you play. But if you neglect this, if you drink a lot of coffee and you don't care about what you eat, you are going to have problem with tendons. And on top of this, as a football is concerned, you have a lot of dirty play. And usually around your heel, in the back of your heel, Achilles tendons are exposed to a lot of penalties, a lot of kicks, intentional slamming of shoe into the tendon. And this creates additional trauma, which it needs increased flow of lymph to kind of soothe it out, because this creates heat. You have to cool it out more. And more lymph goes in there. Lymph is toxic. Bingo! You are going to have more likely problem with tendinitis. And also the injury, just one good kick in the tendon, it can cause partial breakage of a collagen fiber within it and weaken the tendon and go into situation I was explaining earlier of small buildup of liquid, inflammation, painfulness, and to heal it, you have to expose it to heat. Normally, if it just happens, you are hit and your tendon hurts, you cool it down, because by cooling it down, you prevent flow of, you constrict capillaries and the whole area, so even less lymph can go in there. So there is no buildup of the liquid and no swelling. But for healing purposes, after, let's say 24 hours later, the day after, you start putting heat on the area to increase circulation so the area can be cleansed quicker. But again, if you have a toxic blood, you are going to have marginal success, because yes, you will take some bad things out, but you will bring bad things in. So we could never forget about the need of clean blood. And now we know how to cleanse the blood. We know that the body will cleanse the blood as soon as it has enough plasma. So we don't have to start any particular thing. We just have to provide plasma, and body will hydrate. And when the sensor senses, okay, there is plenty of blood plasma and toxicity is bothersome, it is going to trigger detox. Usually, the toxins are not very problematic, and since we are all dehydrated because of the soyence that tells us to eat incorrectly and to hydrate incorrectly, and everything that soyence tells us is opposite of the truth, we become more and more dehydrated as older we get, and now even young, because we eat garbage and purposely polluted toxic food. So our toxicity increases rapidly, even during a young age, and we start having problems with breaking muscles, breaking tendons. In the past, it was a very rare occasion that some individual in sports would break a muscle or tendon. But now, a lot of sprinters develop this problem. A lot of bodybuilders come out with torn muscles or torn tendon, okay, because their bodies are toxic and everything is brittle. So if you already are suffering, because once when the tendon is injured, it takes a long time to repair, because again, it is supplied through lymphatic system, which circulates slow and even slower when it's toxic. Much slower when it more toxic it becomes, slower the lymphatic circulation is, because toxic lymph is being limited in how fast it can enter the blood, so it does not create problem with toxic blood. And this is one of the major causes of stagnating lymph. You know, you listen to Dr. Joseph Mercola, and he will put you on trampoline and jump. This is good. Yeah, this is going to do diddly squat if your blood and your tissue is toxic. You will shake it. It will not be allowed to join the circulation to avoid symptoms and problems that toxic blood brings. So lymphatic system will be stagnant until you provide enough blood plasma so blood can be cleansed. And even when you do this and blood becomes a little cleaner, well, immediately the sensors are reacting. You remember, it's all run by programs, and as soon as sensor is showing that toxicity of our blood has gone down, well, another sensor is activated saying, okay, lymph can go a little bit faster into the blood, so because now the capacity of taking some toxins from lymph is a little higher. But as soon as blood is becoming more toxic, again, signaling goes the other way. Okay, slow down the lymph. There is no way we can take more into the blood until this cleanses out. So sometimes it is very good to take diuretic, because when you have lymph will never be as toxic as that the body would react to it. Oh, we have to get it out, it's so toxic. No, it's marginal toxicity, but it's saturated. And when blood, you want to cleanse the blood, and there is not enough blood plasma there, though a lot of it is stuck in a tissue, again, the body is not conscious, so it doesn't realize it's that, okay, but let's get rid of this toxic stuff, put it in the blood, and then just clean everything out. Well, body is not conscious to ration. It's stupid, mechanic, electronic robot. It reacts on sensors that engage the programs and has a calculator, the Pentium chip, that then decides, okay, hydration or detox, hydration, detox, hydration, detox, or both, hydration and detox, depending on a flow of plasma, ability of plasma inside of the cell. So it's a little complex process, but not that difficult to understand. If you are suffering from a tendinitis, then keep in mind that you have to cleanse. And cleansing on a cellular level and hydrating on a cellular level, which means you have to watch what you are consuming. So this way you are minimizing bringing toxins into the blood so you can eliminate more efficiently. And sometimes, if you want to speed it up, it is good to use diuretic, because now you're putting little toxin that is problematic, and the sensor says, "Oh, this has to go out, this has to go out, this is more toxic than the lymph and then the blood, and has to go out." And if there is not enough plasma in the blood, then lymph is going to be allowed to shoot into the blood and use the lymph to get the diuretic poison out. And this is what causes the water retention to go down. And we'll do the same also for the muscle and tendon. So you can use diuretic to help yourself if you're in an extreme situation, pain, and you want to kind of speed up the detox. You can do it, but still, even when you use diuretic, you have to continue using the plasma, because you have to keep bringing the clean plasma in so the toxic stuff can be going out of the body. I think that the explanation is sufficient, that you understand what is going on and what to do. If you have a problem with one tendon or one joint, treat it nicely, don't abuse it, allow time for it to heal, to hydrate and cleanse and repair itself. So be easy on it. And when it's repaired, and especially when it's clean and hydrated, you can do whatever you want. It's never going to break. But healing, cleansing, and hydration is absolutely necessary process if you want to get rid of these occurrences of tendinitis. Well, thank you for listening. Love you all. God bless us all. Till next time. Bye-bye.